We're going to continue on with this week's lecture. We just talked about the diet or food aspect, and now we're going to talk a little bit about the exercise or physical activity aspect of weight loss. So we'll talk about some of the frequent questions that come up and some considerations when you're thinking about how to include physical activity as part of a weight management program. So some of those frequent questions that come up in regard to exercise are, what kind of exercise is best? Or what's the best time of the day to exercise? How long do I need to exercise? How often do I need to do it? Does it all have to be at the same time, or can I do little bouts throughout the day? So these are all questions that come up that I want to kind of address and help you start to think about, and I probably won't provide all of the detailed answers in this lecture piece, but just some considerations as you're talking to individuals about the role of exercise in weight management. So first of all, when we look at what kind of exercise, often we think of sort of the three different types of exercise being aerobic exercise, strength training, and then stretching or flexibility type of exercises. Now, when we think in terms of weight loss, really, and we'll talk about this in a minute too, but really, calories do matter. Again, same as we talked about with food. So if you're exercising in order to burn calories and lose weight, the calories do matter. Typically, the aerobic type exercises use large muscle groups, and you tend to burn more calories for a time stretch because you can go on a little bit longer with those exercises. Now, strength training builds muscle mass, and we know that muscle is more metabolically active, or burns more calories, probably is a more accurate way to say it, than fat mass does. So as we build muscle, that helps with our overall metabolic rate, and it also burns calories while we're doing it. Another thing with strength training is that when people are losing weight, by restricting calories in their diet, they are going to lose some lean muscle mass. And some of that strength training and exercise in general can help preserve that to some extent. So it can be helpful. It doesn't totally eliminate typically the loss of some lean mass, but minimizes that. And then stretching, flexibility type exercises are kind of important, or they are important for overall health. Typically, they aren't burning as many calories, but important to keep your body safe while you're doing other types of exercises. So that flexibility type of activity is also important. Some types of exercise or activity or movement like yoga that sometimes people think of more as a stretching flexibility actually also burns a fairly significant amount of calories. So in terms of what kind is best, I don't think there really is a best. Now, I think it's important to think about having a balance, and I also think it's important to be realistic about what the goals are with your exercise. If you're really trying to look at how many calories are burned, that's going to be a factor with the type of exercise you choose. So ideally, someone is participating in all three of these types of exercise, or some exercise that falls in each of these categories. When we think about frequency and timing, I always think that this is a really sort of a difficult question to answer, not because that we don't really know the answer, but um, it, it's important to think about how you're framing the message. So one thing that I think is an important distinction, are we talking about exercise specifically for weight loss? So saying I'm trying to burn calories to lose weight through the exercise, or are we thinking about general health? And then the other piece of distinction I have on here is, are we looking at what the frequency should be for your ideal goal, sort of like best case scenario? Or are we talking about what should be the frequency and the timing for a starting place if someone's just starting to be more active regularly, more physically active, have more exercise? And I think that's important because the answers are going to be different. And for most people who come for weight loss, I would say that often they're needing to start more slowly, and that's absolutely what they should be doing, and that's fantastic. But when they are starting slowly, when they're not able to do a lot of exercise because they're working on conditioning, they probably aren't going to be able to do enough that burns so many calories that they're going to lose weight from it. That's not to discourage them, that's just to be very honest and truthful about what it takes to lose weight from exercise. So one key message, and I put it in blue here because I really, really think this is important for people to hear: any exercise is good exercise. Any physical activity and movement is good for your body, but it doesn't mean that it's always going to result in weight loss. The goal for weight loss, it really takes about 60 minutes for most people, takes about 60 minutes a day for most days in order to lose weight. Most people need to build up to that, and for some people that is not something they're going to be able to do. That's not something they're going to prioritize to have that much time for exercise, and that's okay. I think what we don't want to do is discourage them from doing any exercise because they don't feel like they can meet this standard. The reason I think it's really, really important to be honest about this, though, is I have worked with a lot of patients for weight loss who felt like and had heard, if, kind of if they do 20 minutes of exercise 3 times a week, that's sort of the goal for exercise. If that's more than they're doing, that's great, and that's going to give cardiovascular benefits, it's going to give health benefits, but they probably aren't going to lose weight from it. And I think it's important for them to know that, because otherwise they feel like a failure when they do their 20 minutes 3 times a week and don't see the weight loss happen. So I think it's really important in exercise that we get an accurate message across, so we're truthful with people about what exercise can and can't do, but also that we're very encouraging to really try and get any amount of physical activity in that they can do. So I kind of think of the quote unquote side effects of exercise. So again, because this is a weight management class, we're assuming that people are coming in with the idea that they're going to exercise to lose weight. Well, the reality is it takes a lot of exercise to burn those calories, but there are a lot of things that I consider kind of side effects if someone's thinking about exercising for weight loss. They often have improved mood and just general feelings of well-being when they're exercising. Well, for most people, when we feel better, we make better health choices for ourselves. So then we probably make some better food choices. And so those are all really good things that aren't a direct calorie burning factor of exercise. The other thing is, if we're being more physically active in our life, that decreases some sedentary time that may trigger overeating. So I guess one example here is, it's not uncommon for watching TV to people have snacks when they watch TV. And so if they're doing something more active than watching TV, that sort of takes away from that TV trigger that might, or that TV stimulus that might trigger the overeating. So I think we need to think about exercise more globally than just simply the number of calories it burns. The other thing is, when people focus on just the calories burned, it tends to be not motivating for the long term. They tend not to find exercises that are as fun for them personally, that feel good for their body. And that piece is really, really important when we look at sustainability of continuing on that exercise pattern. So kind of a few bottom line messages. In my opinion, I think these are important messages. So exercise, really what research shows is that exercise is more linked to maintaining weight loss than to actually losing the weight. So generally people will have to make changes in their diet in addition to increasing the physical activity in order to lose the weight. But exercise is absolutely linked to maintaining that weight loss for the long term, which of course we know is really what's important. Lots of people lose weight. The key is whether that weight can stay off. So that's the first bottom line message. The second thing that I think is really important to communicate to people is that the benefits aren't all or none. And by that, I mean you don't have to do 60 minutes of exercise most days of the week to realize the benefits of exercise. So you are going to have health benefits with a wide range of exercise. And in fact, when exercise gets too extreme, sometimes there are negative health consequences there. It's not always more is better. But I think it's important for people to know they're going to have benefits even if they're not reaching what they feel like is their ideal goal for the quantity of exercise. And finally, the benefits of physical activity far exceed a number on the scale. So if we can really help people see some of those other benefits besides weight, if the weight loss happens with it, fantastic. If we can help do some other things in terms of food intake adjustment for the weight loss to accompany the exercise, that's great. But I think we need to really help people beyond looking at the number on the scale for the benefits of exercise. often if people start their changes in their life, if they're trying to make health changes and they start with exercise, they often won't see much of a number change on the scale initially, but they may notice changes in their tone of their body, their measurements, some of those kinds of things. So really helping people shift the mindset. So those are kind of some basic things with exercise. Again, thinking about these types of ideas as you look at various weight loss plans and popular diets that are available. And then next, we'll look a little bit at behavior modification and how that ties into diet and exercise.